I had the opportunity to obviously join Victress last year, made the personal choice to kind of just take a different route in the healthcare world. It's tricky, and so being able to now have the decision of like, what do I want to be able to provide for my employees was exciting, but also daunting because of just the logistics and understanding the process, and the cost aspect of it is huge.
As costs continue to rise in that department, people want to know that their money is going to see results, you know? And I think people today, more than ever, don't see the results with conventional healthcare. One size fits all.
Or is a great option for healthcare in itself, especially for those that only carry major medical for catastrophic events, that they can get some preventative care and, you know, all in total, everybody.
But I really was pushing for something that was a little more non-traditional because I wanted to be able to provide our employees and our team with an actual benefit that was useful. And I found like my experience at Victress was, I recommend it to everybody that asks me anything. And so I really wanted to be able to provide that experience and that resource for our team members. It was also accessible. You guys, everyone's been great to work with, and it's been an easy process. And I feel like that was, in the process we did to get there, was easier than when we were starting to look at the logistics of trying to figure out, you know, more of the traditional medical insurance route.
Healthcare is always a big one, and looking for an option that is different, something that we thought would actually work, kind of led us to seeking out what you guys had to offer for us.
So for us, yeah, healthcare is corrupt. It becomes very agenda driven. There's a lot of politics behind it. There's a lot of number crunching behind it. So when insurance companies make decisions, it's not always for the best of the patient, unfortunately.
I don't want to be down on conventional healthcare, you know, because all of us in healthcare try our best, but there's like our environment inhibits us from doing that. How many of our physician friends in the hospital tell us about the short appointment times and that they have to spend with their patients? So you're forced to cover a ton of stuff, fill out and check mark your algorithms on your computer. I mean, I hear more people talking about wanting to get out of it than staying in it. And the model that you guys have developed is definitely a great alternative.
And I didn't know if it was more just because I'm a mom of twins, or is there something more to it? And I just felt like I always got, here's a medicine, or you're just a mom. That's just, you know. So I was interested in actually getting blood work done and actually seeing, was there something more to it than just being a mom or just another medication?
You know, people want insurance plans and all this kind of stuff, but people still have to spend out-of-pocket money. I know very few people that tell me their health journey that don't speak about, despite having the greatest insurance, still needing to spend money out of pocket. And so they just want to make sure that they're seeing results for it.
Is it about money? I do feel like I never once felt like it was about that. It was just truly trying to make me better. So I feel like if you do feel like you're starting to not maybe trust things on where this would be at least a point to have a consultation. Yeah, I did. I felt like she did a lot of blood work, just actually trying to figure out the root cause, and her answers wasn't just take this medicine. It was, well, this is just how your body does this, and it was actually more figuring out the root cause of it, which I liked. It was finding an answer, not just masking everything.
They didn't, when they had their encounters with y'all, they didn't feel as if you were just doing the same thing for everybody, right? They knew that they were getting something unique or something customized, and that your intent was to find a root cause to work with them in a very personalized way.
Once you start looking at the numbers and the benefits and what you get out of it, I feel like it turns into like a no-brainer at that point.
Just draw a blank slate. Put away what you think you know and entertain the new and ask why not instead of why. Truly the best advice you can have, because there's so many people that think outside the box. Let them help you think outside the box, because people stand to benefit hugely. So many times you go to a medical doctor and it's this pill, this lab work, and never really getting to the etiology of the problem. So I think for them it was very refreshing.